Upper limb pain can be caused by a variety of medical conditions ranging from acute injuries to chronic diseases. It can occur in any part of the upper extremity, including the shoulder, elbow, wrist, and hand. This pain is often accompanied by weakness, numbness, tingling, or stiffness in the affected area. Healthcare professionals, especially physical therapists, utilize the Upper Extremity Functional Scale, also known as UEFS, to assess the impact of upper limb pain on daily activities. This objectively measures an individual's level of function and is one of the most commonly used tools in physical and occupational therapy. The UEFS consists of 20 questions and assesses a person's ability to perform essential functions such as lifting, reaching, grasping, pushing, and pulling. Each question is scored from 0 to 4. The total score ranges from 0 to 80, where 80 indicates a complete inability to perform the task. The UEFS is typically used by physical therapists, occupational therapists, physiatrists, sports medicine physicians, orthopedic specialists, and other healthcare professionals treating patients with upper limb pain or disability. To use our UEFS, follow these steps. Download our UEFS off our Carepatron platform, which you can find in the description. Have your patient answer each question truthfully, rating their performance on a scale of 0 to 4. Score and document the final results. Add up their responses to get the total score. Record the score and add any relevant notes or comments in your patient's record. Here is a sample of our UEFS from our Carepatron platform. To find our UEFS, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. Thank you for watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.